Let's talk a bit of health now. Now, the Anidaso Parkinson's Disease Foundation Ghana wants government to put Parkinson's disease medications on the National Health Insurance Scheme. Director Dr. Vida Obise believes it will relieve the burden of the elderly who are already burdened with other diseases. She was speaking at a forum as part of activities to mark World Parkinson's Day.
Dr. Obese observes Ghana's growing aging population requires attention to diseases such as Parkinson's disease. The foundation also launched the book Understanding Parkinson's Disease, an introductory guide by Parkinson's Africa and IPDGC Africa. The move is part of the foundation's health literacy drive. Dr. Obese appeals for funding for the initiative.
Ghana is now an aging population. Our demographic is moving towards the aging population, and so we are seeing a lot of neurodegenerative diseases such as Parkinson's disease, and so we need to understand diseases such as Parkinson's disease, and we need to ensure that their medications such as levodopa is put on the National Health Insurance Scheme, because the population of patients who have this disease are above 60s, and these patients are already saddled with hypertension, diabetes and other diseases, and for them to add on their medication for Parkinson's disease is very difficult for them. So as a foundation, we are advocating that their medication be put on a National Health Insurance Scheme, and stakeholders pay attention to these patients and ensure that our health literacy drive, such as this booklet and others in the community, are funded so that more.
Though he underscored the importance of spiritual intervention, Anglican Bishop of Kumasi, Right Reverend Oscar Christian Amwa, appealed to prayer camps to allow members to seek medical attention as well.
In fact, even World Health Organization now understand that when you are talking of health, the spiritual part is also there. You see, so I will talk about those in prayer camps who would camp patients without allowing them to go for medication or for treatment at the hospitals. That is very dangerous. So even when they are there, supposedly, they can also be seeking support at the hospital so that together their health will be restored or well managed.
April 11 every year is designated as World Parkinson's Day. The theme for this year's celebration is Parkinson's is. Professor Fred Stephen Safo is a neurologist at the Konfanochi Teaching Hospital.
This year, the emphasis is on creating more awareness about Parkinson's disease. So if somebody in a community has Parkinson's disease, for instance, how will the person know that this is Parkinson's disease? Number one, if you realize that the way you walk has become a bit slow. Number two, if you feel that your muscles have become a bit stiff or rigid. If you see that the hands begin to shake at rest. These are some of the things that you should look out for and then come to the hospital.
And on that note, we wrap the AM News. Up next, the News Review. Do stay.